Hello, this is Dr. Grande. Today's question is, what is the difference between schizophrenia and schizophreniform disorder? Now, these two disorders are easily confused. They're quite similar. So I'm going to start with the diagnostic criteria, the symptom criteria, with schizophrenia. So with schizophrenia, there are 5 symptoms in criterion A. And we can think of these 5 symptoms divided into 2 categories. The first category is delusions, hallucinations, and disorganized speech. And the second is grossly disorganized or catatonic behavior or negative symptoms. An individual needs to have 2 or more of these symptoms, but one of the symptoms has to come from that first group, the group that contains delusions, hallucinations, or disorganized speech. Now, the full criteria of schizophrenia need to be met for over 6 months for that diagnosis. When we move to schizophreniform disorder, we have the same symptom criteria, except the time frame, instead of being greater than 6 months, is 1 month to 6 months. Another difference we see with schizophreniform disorder as compared to schizophrenia is there's no criterion for impaired social or occupational functioning with schizophreniform disorder. Now, there are also a number of specifiers with schizophreniform disorder, and I'm going to focus particularly on 2, with good prognostic features and without good prognostic features. If an individual doesn't qualify for the first specifier, the with good prognostic features, they would automatically get the second. So let's just take a look at that first specifier. For this specifier, there are 4 criteria, and 2 or more need to be met in order to receive the specifier with good prognostic features. Again, if somebody doesn't meet that, they're automatically given the specifier without good prognostic features. So looking at these 4 criteria, the first criterion is the onset of prominent psychotic features within 4 weeks of a change in the usual behavior. The second is confusion and perplexity. The third is good premorbid social and occupational functioning. So the social and occupational functioning was good before the symptoms of the disorder. And the fourth is an absence of blunted or flat affect. So schizophreniform disorder is a disorder that's given to individuals who meet the criteria for schizophrenia, but they haven't had these symptoms long enough for the diagnosis of schizophrenia. Now, that doesn't mean that everybody who's diagnosed with schizophreniform disorder will go on to develop schizophrenia. About 2/3 of individuals who are diagnosed with schizophreniform disorder will eventually be diagnosed with schizophrenia. The remaining 1/3, schizophreniform disorder would be their final diagnosis. There would be no progression onto schizophrenia. I hope you found this description of schizophreniform disorder and schizophrenia to be interesting. Thanks for watching.